Good afternoon, Dialysis Patient Citizens Educational Platform today. It's 2026, and my name is Dr. Velma Scantlebury, and I am here with you live for our first session of the year. So welcome everyone. Again, this is our educational session, Ask the Doctor session. And I hope many of you are around and able to log on. And I want to send well wishes to our manager, program director, Nancy Scott, who has been recovering. So thank you, Cameron, for coming on. Again, I'm Dr. Scantlebury. I am a retired kidney transplant surgeon, and I'm here to talk to you about kidney disease, getting on the transplant list, how to stay healthy on dialysis, how to really understand what it takes to qualify for the transplant list, and also how to do well even after a kidney transplant. I've done kidney transplants for over 30 years, and living donor, deceased donor, donation after cardiac death, which we say now we say DCD, because those are donation after cardiac standstill, when the heart stops beating, and we allow 5 minutes or so, and then the organs are removed. And we know that those are also ways to provide more organs in those situations where there is inevitable death, but there is still some brainstem function, and therefore they may not be able to be declared brain dead. So I hope that, lost my light. Let's see if we can get this back on. And so we hope that we can get into a conversation. Thank you, Cameron, for coming on. And I hope we'll get some other folks. So let me know where you're located, and if you're a transplant recipient or whether you're on dialysis. And if you're on dialysis, whether you are on hemodialysis or peritoneal dialysis. So you could also be a caretaker. And so many of those who watch are often caretakers, taking care of their loved ones who may be on a dialysis. So or even those who have had a kidney transplant. And we know that being a caretaker can often be very tiring. It can also be frustrating as you watch your loved ones go through different things and not be able to do anything to assist them with their situation. So appreciate you being here, and hopefully we'll get some others on. Again, Erica, thank you for watching. And coming on, I'm Dr. Velma Scantlebury. I'm a retired kidney transplant surgeon, and with over 30 years experience of doing kidney transplants, and I'm here to answer your questions. So let me know what's going on in your area, any issues with insurance. I know with the new regulations, certainly you are covered by Medicare for end-stage kidney disease if you're on dialysis. Hopefully there wouldn't be any major changes in that from that standpoint, but I know many patients are having issues with medications and when they're changed their insurance, and therefore can have difficulty being able to fill some of their medications. I have one patient who changed his insurance and could not even get his phosphorus binders, and that's critical when you're denied something that is so essential to maintain your cardiovascular health while you're on dialysis. And so that's very important. So thank you all for watching and coming on. Again, Kenneth and Erica and Cameron, we thank you for being here. Welcome, Joanne. So good to see you, and be sure to send me any questions that you may be thinking about and would like me to answer. So I want to shout out to Nancy. I'm not sure if she's well enough to jump on in terms of being being able to monitor, check to see, ask any questions. She's usually the one asking all those questions. So thank you for those of you who are transplant patients, those of you who are on dialysis. And I know Ms. Joanne Smith had a session towards the end of last year. I think it was about really understanding peritoneal dialysis as well as hemodialysis and the benefits, the issues, really advocating for home dialysis, because that is, as you can think about how the body works, how it cleanses your body, and how you get rid of metabolites and how often you get rid of metabolites is what's going to be one of the major determinants as far as your heart, how well your heart does. Because the more you accumulate between dialysis treatments, the more, without being able to make urine, the more your body has to do. And so you want to be able to have that dialysis done as often as possible, whether it's 5 days a week, 6 days a week, cleansing your body, being able to get rid of all those metabolites so that you can have that BUN and creatinine as low as possible. And that's the advantage of frequent dialysis. That's the advantage of peritoneal dialysis, where you're constantly being able to filter your blood. Just imagine you are eating 3 times a day, sometimes 4 times a day, and you're not being able to cleanse your body of the metabolites. They are going to hang around, and they are going to play havoc on your metabolic system, especially your heart and especially your brain. So being able to do that as often as possible certainly is an advantage. And if you think about the fact that even in patients who are able to get a kidney transplant, and that kidney transplant doesn't work as well as you expect it to, let's say the creatinine, instead of coming down to 1, is still in the 3 to 4 range, which we would be very concerned about. However, for that patient, the amount of cleansing that occurs with that kidney transplant, even though it's not functioning well, is often so much better than dialysis, because even with dialysis, you may not be able to get that good of a creatinine or that good of a clearance. And so for patients, we may be disappointed as children. We may be disappointed as caretakers or physicians, saying, now, okay, this kidney transplant didn't do so well. Creatinine is 3.5. But if it keeps that patient off of dialysis for 3, 4, 5 years, it's still a significant improvement when it comes to the cardiovascular issues that patients face remaining on dialysis for those additional 4 to 5 years. Because your time on dialysis, especially hemodialysis, gradually causes significant wear and tear on your cardiovascular system, especially your heart, with all those fluid gains and release, gaining and emptying. We see over time that your heart, in terms of your ejection fraction, slowly deteriorates, and you lose your pumpability of your heart. So compliance is really, really important when you're on hemodialysis, being able to keep your volumes down. And even with a transplant, there are some patients who initially will have issues with not being able to handle the extra fluid until that kidney kicks in, and being able to clear the metabolites on a down to 90% or so. We're glad for those of you who have come on. Again, my name is Dr. Velma Scantlebury, and I am the medical consultant here at Dialysis Patient Citizens Educational Center. Thank you guys who have come on within the last 3 to 4 minutes. We're talking about how to maintain a healthy heart, and also how to really understand that it's important not to skip dialysis. I know with the holidays, sometimes with traveling, we're now in 2026. I don't know, sometimes we travel, sometimes we're going different places, And we are in situations where, or even for some patients in situations where they may not even feel well. And they say, okay, well, I don't think I'm going to dialysis because dialysis makes me feel makes me feel worse. Well, just imagine that if your body is not getting rid of those metabolites, that the overall effect on your body is worse than how you feel over time. So we encourage that. Be sure to post your questions. I'm doing all the talking here, so let me know if you have any questions. For those of you, I think our last session, one of the sessions I did for DPC was about getting on the transplant list and what it takes to get on the transplant list. And understand that most importantly, if you're on dialysis, make sure you have a primary doctor, because your primary doctor can coordinate a lot of these studies or tests that are needed to expedite your waiting time to get on the list. So as you understand what it involves to get a kidney transplant, it's really about making sure all your different organs are working well. We want to make sure that you've had your colonoscopy, if you're of age to have a colonoscopy. You want to make sure that your mammograms are up to date. If you have sleep apnea, so many patients have sleep apnea, make sure that you are seeing a pulmonologist or someone who can give you a recent update, a recent sleep study to verify that you're compliant, because we will have to, that is going to be necessary, because compliance with sleep apnea is also an important key to keeping your heart healthy. So that's what you need. If you're female, make sure you get if you haven't had a hysterectomy, that you're getting your pap smear. So those are standard screening tests that you would have to have done if you are of age and going through your normal health screenings on an annual basis. And so those are important. And if they're done, you have checklists, and so you don't have to do those things. You just get the reports. Dental, make sure that you have dental clearance, that you're seeing your dentist. I know oftentimes our insurance does not cover for dental visits, but you definitely will need to be cleared by your dentist or by a dentist. So if you have cavities or caries, if you need teeth extracted, all those things are going to have to occur before you get listed for your transplant. So it's important to make sure that those basic things occur. The standard blood work the transplant center will do, they will do your blood typing, they will do your HLA to look to see what your genetic makeup is and whether or not you have antibodies that are already present. And so antibodies are those things that will cause you to have an episode of rejection. So how do you form antibodies? It's maybe that you had a previous blood transfusion during the time that you had chronic kidney disease. You might have had an operation many years ago and needed blood, and so you have had a blood transfusion. And not everyone will develop antibodies after a blood transfusion, but it's important to know that some people will. For many women, they may develop antibodies just by having had multiple pregnancies, because as a female, every time you carry a child, that child is genetically only 50% you and it's 50% dad. And some women will develop antibodies to the genetic makeup of that, of the father. And so that becomes important, and to understand that those things can impact. And if you had a previous transplant, if you had a previous kidney transplant or any other transplant, that DNA in your body is foreign. That tissue that has been in your body or was there, oftentimes you remove a previous transplant, is going to leave some tissue of that donor behind. And so oftentimes our bodies will recognize that that tissue is not you and develop antibodies against that tissue from the previous donor. And so it becomes, those things can cause you to have more likelihood of having rejection, because now your body is primed and it has those antibodies that is ready to fight and destroy anything that comes to you that's similar. So that means that if you have a donor that has genetic makeup similar to any of these antibodies that your body has, then your body is ready, already will recognize them, and you'll have an attack of your antibodies against that tissue. So that's the basis of the cross match and understanding if you have pre-existing antibodies prior to the transplant. Some patients may not have antibodies that are detectable in terms of being able to quantify them because as a kidney dialysis patient, your immune system is already compromised, and so your ability to form antibodies may be dampened, even though you may have the stimulus that can cause you to form antibodies. So I hope that's not too very confusing, but one of the things before getting a transplant is deciding what your antibody level is, and if it's really high, it can put you on the transplant list. Higher up, you gain extra points depending on if your antibody level is reacting to many more people than those who may not, because we know that it will be more difficult for you to receive a kidney transplant. Again, I'm Dr. Scantlebury. I am the medical consultant here at Dialysis Patient Citizens Educational Center. Thank you, Nancy, for coming on. I hope you're feeling better. Excuse me, I'm doing all the talking. I wish that there were some questions so I can see what's on your mind. And if anything, I can further explain. So thank you, Joyce and Dortha and Kenneth, who have come on, as well as Monica. I appreciate you coming in, and Happy New Year to everyone. We're in 2026. This is our first Facebook Live for 2026, and I hope that you would also go to the Facebook page for Dialysis Citizens Educational Center. The web page. Look at DPC Educational Center. There's lots of information on there. There's nutritional advice in terms of recipes to keep you healthy. There's information on different kidney diseases, understanding proteinuria, understanding what it is to be to advocate for your care. And we also have many of our callers, those who come on the call, who are participating in advocacy, because it's important for us to make sure that our lawmakers and those who are deciding about insurance or who qualifies for what, that we have a voice, that there is a voice from those who are actively participating in this, in these issues, have a presence, and that we can have that input. So if you want to join the advocacy group, be sure to do so and go on the web page, the website, and sign up. We also have kidney chats that are usually on also, where there's can often be a dietitian or others. You can dial in for those. So there's lots of information on the DPC Educational Center website. So thank you all for watching, and I hope there's anything you would like for me to discuss. Please put it in the chat as we enter a new year. I hope that all of us will focus on self-care. We are generally as taking care of everyone else, and oftentimes we put ourselves on the back burner. But I want for us to remember that it's important for us to find that time to allow for us to be able to have a moment to ourselves, whether it's just for some meditation, to listen to some music, to practice deep breaths, even when we are in the midst of a chaotic day, to be able to just slow down and say, I'm going to spend 3 minutes taking some deep breaths so I can get my blood pressure down, so I can be less aggravated, and also to, in any way that you can, be able to incorporate some exercise. Just remember, your heart's a muscle, and the more you work it and introduce it to more exercise, you push your heart rate up, you also strengthen your heart. And so with more, whether it's chair exercises, whether it's simple exercises, whether it's dancing, the more you cause your heart rate to be elevated, the more calories you burn, and gradually your heart gets stronger and stronger over time. As we get older, we want to be able to understand that we have to also build our muscles, especially as a dialysis patient or even post-transplant. Years of calcium phosphorus metabolism, low calcium abnormalities can cause us to have thin bones, weak bones, and so we want to strengthen the muscles around our bones so that there's less risk of falls. We don't want for you to get a transplant, but your bones are so weak that you can't go skiing or do things because you are afraid of that your bones are so thin. So you want to strengthen your muscles. You want to do that exercise to be able to protect your bones and your joints if in case you fall. Now we're having very cold weather, even here, lots of snow. You want to be careful and that you don't trip and fall. So if you haven't had a bone scan, I suggest that you're over 65, I recommend you you talk to your doctor about getting one to see whether you have osteoporosis and what can be done about it. So I thank you all for here. I wish you had some questions. I am just talking on and on. So one of the things, we talked about dialysis, we talked about transplant, and one of the things I want to mention for those of you who have had a transplant is virus infections. And a lot of patients are often unaware of things except through the education, things like BK virus and CMV virus and herpes virus. Those are the three viruses that we heavily screen for after transplant, because viruses stay dormant in our body. And while we think that we may have these virus infections a long time in the past, CMV is just another cold virus. BK virus is CMV is cytomegalovirus. It's a cold virus. BK is a polyomavirus that tends to live in your kidney and can be excreted in your urine. 85% of people, 90% almost, will have had previous exposure to these viruses, and they live dormant in your body. And so for the average person, it's not going to cause an issue. But for the transplant patient, you're now immunosuppressed. What that immunosuppression will do is it dampens your body's protective mechanism so that your body doesn't reject your kidney. But what it also does is it lowers your immune system so that now there's no protection for those viruses that have been dormant. You've now opened a door for these viruses to suddenly say, oh, I can come out because now there's no protection, there's not enough protection. And so we see patients with the height of their immunosuppression or after they have been treated for rejection will now have these viruses pop up either in their blood or the urine. Generally, we'll monitor them to see if they need to be treated. And so if you've had a transplant, you know that you are going to be on antiviral therapy for the first 3 months or so to protect your body against those viruses that may come out, especially CMV. Many centers would check your blood or your urine to see if the BK virus, and you're generally on the acyclovir, valcyclovir, both to cover herpes and CMV as they're similar viruses. And so those are important to understand because both CMV as well as BK virus can also attack your kidney and cause a nephritis or nephropathy. And in the first 3 months or 6 months, we're checking to see if that virus has increased and if that virus is able to invade your kidney, how bad is it, and does it need to be treated with antiviral therapy for a few weeks or a month or so to see if if the number of copies of the virus that is shown in your urine or your blood is decreasing. So we don't want to get a transplant and then have it be lost to a virus infection. So those are the things that are monitored immediately after transplant. We're also monitoring for infections, other infections, urine infections from bacteria, as well as the most common thing we're interested in is rejection. Is your body rejecting? And not all rejection is bad. Your body may recognize You may have an acute rejection. We may treat it with anti-rejection therapy by increasing prednisone, increasing your anti-rejection medicines, and making sure that your creatinine comes down to normal. Most centers will do a biopsy, which is pretty standard, to make sure that your rejection is resolving. If we are uncomfortable, there's also some DNA testing that's now being done to look for donor DNA, which is less invasive than the biopsy, and so you can look for the presence of donor DNA in your blood. That gives you some information about whether you have an inflammatory response, which can also be seen with the virus infection, or whether there is some rejection, remember, rejection is also your immune system attacking your kidneys, so it's also going to appear as some inflammation. So I am so appreciative of all of you who have stayed on, and I thank you for being here. We're now I have about 4 minutes left. Maybe if you guys are not able to put any questions in the chat, but I appreciate you being there. And I have been talking quite a bit. I hope we've covered some topics, and we want to make sure that you, really, if you're on dialysis, thinking about getting a transplant, even if you're on dialysis or not, you should have a primary, because your primary physician is the one who's going to coordinate all of your cancer screenings, all of your preventive exams, and keep you healthy. Remember, your nephrologist is there to take care of your kidney, monitor your dialysis treatment. But as far as the rest of your body, you want to make sure it's your primary doctor who's going to coordinate to make sure that your heart's, that whether or not you need to see a pulmonologist because of your severe asthma or your sleep apnea. Your primary is also going to say, okay, you have some atrial fibrillation or some cardiac disease. I'm going to make sure you see a cardiologist, and especially if you're diabetic. You need to have your eyes checked on an annual basis, as well as to get your feet checked by seeing a podiatrist. So those are things that may not necessarily be handled by your nephrologist. If they are, congratulations to you. If not, we want to make sure that you're getting those health checks on an annual basis. What's going on with your cholesterol? Not laying down more plaque, controlling that, so those things are very important. Making sure if you have a colonoscopy or abnormal Cologuard test, that you get referred to the appropriate people for the appropriate treatment. And one of the things with the transplant is you want to make sure that you're not missing any cancers. So surveillance is key, and getting those tests done also will put you ahead as far as getting the multiple tests done that are required by the transplant center. Lastly, remember, you can be listed in more than one place, more than one center, as long as they're not in the same catchment area or share the same organ procurement organizations. And so if you happen to have a waiting list that's 10 years in your area, you may want to see if you can get on another waiting list that has a shorter waiting time, because you can multi-list as long as you are able to travel to that center, and as well as continue to get your care post-operatively, at least for the first year, at that transplant center. So remember, you have options, and you want to be able to utilize those options as much as possible. Thank you all for watching. I appreciate you being here on this first Facebook Live for 2026. And be safe for those of you who are likely to get some snow this weekend, and those who are already covered in snow. Stay safe. And for those of you who are in the warmer areas, enjoy the good weather if you're having good weather. But remember, we still have a lot of COVID and flu. This is COVID and flu season, so if you're gathering with others, protect yourself and make sure you stay free from infections if at all possible. Be blessed, and see you next time.